Hello, everyone, and welcome to this interview. Myself, Dr. Ashwani Kumar, and I'm very pleased to have Dr. Amol, who recently scored rank 31 in the INI-CET exam, which was conducted few days back only. Well, many congratulations, Dr. Amol.
Thank you so much, sir. Thank you.
Dr. Amol, first of all, people want to know about you. Just formally introduce yourself. Tell that which college you did your UG from, and which city are you from.
Hello, everyone. I'm Dr. Amol Sood. I am basically from Palampur, Himachal Pradesh, and I have done my MBBS from AIMS, New Delhi. And I got All India rank 13 in the AIMS entrance exam at that time, and this time I've got AIR 31.
So you just flipped the rank only, like 13
Yeah,
became 30.
1-3 became
Okay.
became 31. Yeah.
Wonderful.
Yeah.
Okay. Dr. Amol, tell us about, was it your first attempt to this INI-CET?
Yes, sir.
Okay. Okay. So you did not give any exam before that?
No, I did not give any exam for this.
Wonderful. Like first attempt being 31, that's wonderful. Okay.
Thank
Amol, just tell us a little about before we start with the rest of the formal interview. Because we are kind of squeezed between the INI-CET and the NEET now. So I want to know your thoughts कि यार एक INI-CET में और एक NEET में preparation करने में आपको क्या लगता है कि कुछ strategy में कुछ difference है? Is there any difference between the two, or like we should follow the same track only?
Sir, I think if someone's concepts are clear, basic concepts are to be made clear first. मतलब subjects तो दोनों में same ही हैं. तो अगर जो subjects हैं उनके basic core concepts clear हैं तो फिर ज़्यादा problem नहीं होती. और in addition उसके बाद अगर जो exam के लिए आप prepare कर रहे हो उसके आप past year questions कर लो तो आपको idea लग जाता है कि किस टाइप के क्वेश्चंस पे या किस टाइप के टॉपिक्स पे वो ज़्यादा फोकस करते हैं. और एग्जाम से जब आप फोकस्ड प्रिपरेशन अपनी स्टार्ट करते हैं तो उन टॉपिक्स पे फोकस करके आप अपना उस एग्जाम की फोकस प्रिपरेशन कर सकते हैं. बट बेसिकली जो पढ़ाई है वो तो एमबीबीएस की ही पढ़ाई है, तो उसमें कोई ज़्यादा डिफरेंस नहीं है मेरे ख्याल.
ओके. तो डॉक्टर अमोल, व्हेन डिड यू स्टार्ट एक्चुअली? आपने कब सोचा था कि मुझे कोई भी किसी भी तरह का पीजी एग्जाम निकालना है? तो लाइक वर यू लाइक काइंड ऑफ अवेयर अबाउट इट सिंस योर सेकंड थर्ड ईयर ओनली, या फिर आपने जब इंटर्नशिप वगैरह शुरू हुआ तब आपने सोचा कि ओके आई नीड टू प्रिपेयर फॉर समथिंग?
सर, मैंने अपने बाकी बैचमेट्स के साथ जब मैं सेकंड प्रॉफ हमारा कंप्लीट हो गया एम्स दिल्ली में, तो हमारे वहाँ पे थोड़ा एक डिफरेंस है एम्स दिल्ली में, दैट वी ओनली हैव 3 प्रोफेशनल एग्जाम्स, नॉट 4. सो
Yeah.
आफ्टर द सेकंड प्रोफेशनल एग्जाम मैंने अपने बैचमेट के साथ भाटिया कोचिंग ज्वाइन किया था. तो आई अटेंडेड डॉक्टर थमीम सर्स क्लासेस,
Okay.
so and a few other classes as well, clinical subject.
You attended Dr. Thavim's class in third year only?
Yes, sir, in 2019. Yeah.
Okay. Okay. So how was your experience? I'm
It
like,
was excellent, sir. He taught the entire, I mean, he gave a very, very good foundation for the entire subject of medicine, which is a very huge subject. And once you understand medicine, you can kind of revise your physiology, pathology, pharmacology.
yeah.
So, matlab, Thameen sir taught it in a way that was very easy to remember, and what he taught was in a very logical manner, and he also taught us how to approach MCQs. Like he said that it's always best to do it in the rule out kind of manner. Don't jump straight away to the answer. Rule out all the other options. So that is a strategy which I found useful for.
Well, he's a legend for a reason. Like, no one can teach medicine the way he does. And well, you rightly said about Dr. Tamim. And what other classes you attended? Online, offline, whatever way. What other classes in DBMCI you attended, which you liked?
Said, sir, I attended your classes, so they were very good. I attended all your last minute revision program classes, so they helped me revise anatomy very concisely and very thoroughly, because all the questions that came in the exam could be answered after attending your classes and reading some of the notes that I had made earlier in my during my MBBS years. So they were very nice, and I also attended the pathology LMRP classes and the ophthalmology LMRP classes. they were also very nice.
Okay. Acha, Dr. Amol, as I said, completely unfiltered. I want to know one thing. Nowadays, not too much of, we have a problem of too many and too much. There's so much is available to us, so many apps, questions on every platform. So how did you manage it? Like, how did you actually came out of this FOMO thing? Like, how did you able to focus on what you want to read? Because I'm sure everyone is distracted. We are all on social networking, and there is always a fear of missing out. The moment you're done with the subject, you feel confident, but you then start solving questions on the different platforms, and you see some difficult questions. लगता है कुछ अलग ही पूछा हुआ है उसमें, and that's where the doubt creeps in. आपको लगता है कि यार मेरी preparation में कुछ problem तो नहीं है. तो you being a top ranker, I think you should tell us कि आपने क्या किया? Like, did you like जो भी आपके सामने question था सब करते थे आप, या you were like कि मुझे क्या करना है और क्या नहीं करना है?
I focus mainly on the previous year's questions because what advice I had received from my seniors in college who had got good ranks before was that you should always go for the previous year's questions, because in INI-CET and also in NEET PG, there tends to be a lot of repetition of topics as well as questions directly. So if you have done the past year's questions well, then there's a good chance, and you have reviewed the relevant topics around those questions, then there's a good chance that they'll get repeated and you'll get a good rank. So instead of focusing too much on vague things, just
Yeah.
focus on the past year question and the topics that you have read in the class around them. And I think that's sufficient.
I mean, you need to draw that circle around you. You should know कि मुझे इतना पढ़ना है. Like, I know कि previous topics important क्या है. Rather than like reading new things every day, it's better to consolidate the topics which are being asked over and over again. So that
Definitely.
probably what you did, and that worked in your favor as well.
Yes.
Acha, Dr. Amol, tell me about the one more thing which everyone is going through right now, that stress and anxiety that we have. I've seen so many people who are really good at, like really prepared well, but one bad day, maybe exam के दिन अच्छा नहीं हुआ, या फिर exam से एक week पहले बहुत stress हो गया, anxiety हो गया, could not sleep and the exam didn't go well. तो are you the kind जिसको बहुत जल्दी stress होता है, anxiety होती है, और होता है तो फिर like how did you manage?
Yes, so I do get stressed, but my biggest support system is that my parents always support me. Both of them are doctors. So my father always tells me that your competition is only with yourself. So if you don't do well on one day, but on another day you do better than what you did the previous day, then that's an improvement. And if you keep on doing better each day, then that's ultimately what you are going to aim for. The competition you have is only with yourself. So
That's a wonderful
that,
advice. A wonderful advice. Okay. I mean, even I believe that the only way you can come out of this stress is kind of not like hanging to this social networking site, but to meet people, like
yes,
be with friends, be with parents. No, they are उनसे बड़ा stress buster क्या हो सकता है? Like rather than like
definitely.
finding the solution on Insta and Facebook, like that's the best thing. Okay. Uh, well, Dr. Amol, I want to give you this opportunity that if you want to use this platform to thank anyone, your parents, your colleagues, whoever with their name, just please go ahead.
Yes, definitely. I would thank my father, Dr. Ajay Sood. He's a consultant in gynae in Dr. Rajendra Prasad Government Medical College, Kangda, Himachal Pradesh. And my mother, Dr. Preeti Sood, she's a senior medical officer in Civil Hospital, Palampur. My grandparents, Mr. Shashikant Gupta, Mrs. Raj Gupta, and all my teachers at AIMS Delhi, without whom I would never have studied this well during my MBBS, because what we study in our classes is the most important of all. And I would also like to thank the teachers here at Bhartiya Medical Institute, especially you, sir, Dr. Ashwani, sir, and Dr. Thameem, sir. I would like to thank them all.
Okay. Well, Dr. Amol, any last piece of advice? You can take your time and just guide the juniors कि क्या करना चाहिए, and especially looking at the NEET, like down the line, 3 months है. I know that one size doesn't fit everyone, but आपको क्या लगता है कि what should be their strategy, how to keep cool, and what they need to focus on? Just kind of give your piece of advice to your juniors.
So I would advise you to keep calm, make a schedule for each day. So if like there are 3 months left, you should make a general schedule about what you are going to do each day, how much material you are going to cover, and do make it a point to solve some questions each day, because in the end the exam has multiple choice questions, and solving MCQs itself requires practice. So instead of reading theory the whole day long, it's better to do MCQs, because MCQs themselves are a great learning tool. Then I would advise that don't read anything new just before the exam. Just try to read your notes again. If you have any doubts, try to get them cleared from your teachers or your friends or anybody whom you like. And on the day before the exam or a few days before the exam, don't study too much, because whatever you have studied, you will remember it. It's important to be well rested on the day of the exam and do your best.
Well, Dr. Amol, thank you for all the advices. Thank you for being on the platform. Thank you for the interview, and
Thank
thank
you,
you
sir.
for being such a gentleman. And yes, your parents, we, your friends, everyone is extremely proud of you, and we really wish you all the very best for the future endeavors. Thank you so
Thank
much.
you so much.